Let's talk about dysfunctional uterine bleeding, also called DUB. DUB is a condition characterized by abnormal, irregular, excessive bleeding from the uterus that is not caused by underlying structural abnormalities or medical conditions. It typically caused by hormonal imbalances that disrupts the normal menstrual cycle and can occur at any age from adolescence to the perimenopausal stage. It's a common gynecological problem that can occur at any age and can significantly impact a person's quality of life. The exact causes of DUB is not usually known. However, several factors can contribute to its development. Fluctuations in estrogen and progesterone levels can disrupt the normal hormonal signaling that regulates menstrual cycle. Also, lack of ovulation, which occurs in certain conditions such as polycystic ovarian syndrome, can lead to hormonal imbalances and dysfunctional uterine bleeding. Benign growths in the uterus, such as uterine fibroids, can disrupt the normal uterine lining and lead to abnormal or dysfunctional bleeding patterns. In rare cases, abnormal cell growths in the uterine lining can cause DUB. Certain medications such as hormonal contraceptives or blood thinners can cause changes in menstrual patterns and contribute to the incidence of DUB. The main symptoms of DUB is abnormal bleeding patterns, and these bleeding patterns could be heavy or prolonged menstrual bleeding, frequent episodes of bleeding or spotting in between periods, intermittent or unpredictable bleeding, irregular menstrual cycles, menstrual periods that are longer or shorter than normal, blood clots during menstrual bleeding, and in rare cases, fatigue or anemia. Diagnosing dysfunctional uterine bleeding typically involves a combination of methods. The healthcare provider will inquire about the menstrual history, the associated symptoms, any underlying medical conditions, and the use of medications. A physical examination may be performed to assess overall health and to rule out structural abnormalities in the reproductive organs. Blood tests may be conducted to measure hormone levels such as that of estrogen, progesterone, thyroid hormones, or certain pituitary hormones to also assess hormonal function. Ultrasound scan or imaging tests may be used to evaluate the uterus and ovaries for any structural abnormalities or growths. In some cases, a small sample of uterine tissue may be taken and examined under a microscope to rule out other causes such as endometrial hyperplasia or cancer. Treatment for DUB depends on several factors, and these include the underlying cause, the severity of symptoms, and the individual's preferences. Hormonal medications such as the use of combined oral contraceptives, progesterone-only pills, or hormonal intrauterine devices can help regulate the menstrual cycle and reduce bleeding. Medications such as ibuprofen can help reduce menstrual pain and reduce bleeding. In some cases, a procedure called endometrial ablation may be recommended to remove the uterine lining and reduce bleeding. If other treatment options are ineffective, or if there are specific underlying causes such as uterine fibroids or polyps, surgical procedures may be necessary to address the issue and restore normal bleeding patterns. In severe cases or when other treatments fail, removal of the uterus, a hysterectomy, may be considered as a last resort. Preventing DUB may not always be possible, but certain strategies can help manage the symptoms and reduce the impact on daily life. These strategies include consistent use of hormonal contraceptives, such as birth control pills or the hormonal IUDs, because they help to regulate hormonal levels and menstrual cycle. Implementing stress reduction techniques such as exercising, meditation, or therapy can help manage hormonal imbalances and reduce the impact of stress on the hormonal cycle. Maintaining a healthy lifestyle, including regular exercising, a balanced diet, and adequate sleep, can promote hormonal balance and overall well-being. Regular gynecological checkups are important for early detection and management of any underlying conditions that may contribute to DUB. To summarize, dysfunctional uterine bleeding is a common gynecological condition and is characterized by abnormal, irregular, or excessive bleeding from the uterus. It can significantly impact a person's quality of life and may require medical intervention to manage symptoms and prevent complications. Hence, it's important to understand the causes, the symptoms, make a diagnosis, and have treatment options for DUB to help seek appropriate care and to improve overall reproductive health. Hence, it's important to have an open communication with your healthcare provider and adhere to recommended treatments and self-care strategies to better manage symptoms and to help live a better life.